I had a tremendous fear of the unknown. Cancer is a very ugly word. I had gone for other opinions in different parts of the country. They recommended the brachytherapy with the radiation, and Dr. Pranic was the guy. Shortly after the implants were placed, and you're back to your normal activities in a couple of days. So that's better than the operation itself. We did a PSA early on, and my PSA was dropping very rapidly, which was a good sign. And I was pleased with at least an indication that we were going in the right direction. I see Dr. Pranic about every 2 months now. In another few months that I'll probably be seeing him semi-annually. And everything should be falling into place within the next couple of months. So this is where I decided to come.
First was more shock than anything else that it could happen to me. We had, I think, 4 or 5 different choices at the time. It came down to either doing surgery, which was very invasive. I didn't like it because several of my friends had surgery done. Then there was the seeding, and I can't think of the name, Brack something it was called, but it was the internal seeding. And that's where I got involved with Dr. Pranic. I had all the confidence in the world about this procedure. One of the procedures could have been external radiation. But at that time, I was doing sales, and external radiation meant that for 8 weeks, I had to go for 5 days per week for 5 minutes, killed the whole sales trip for me. This was the best way because we went into the hospital at 6 in the morning. They prepped me. I went into the operating room. They took me in. Everything's done by a computerized. Less invasive than any procedure I know of. 2 hours after I came out, 5 o'clock I went home. This was on a Friday. Saturday and Sunday I played it to the hilt, did nothing, at home. Lied on the couch, watched television. There was nice ball games going on. And Monday I was back on the road again. Every 6 months we'd take a PSA test, and my PSA dropped down to 0.3 or less. And they consider anything below 0.5, actually 1, was pretty good. I play racquetball 3 days a week. I'm very active. I go the other 3 days to the Y, and I work out. I've had no problems sexually, none whatsoever. I had more concern whether I was going to lose my sexual drive than my life. In fact, when we went through the clinical study at the hospital for 5 years, one of the questions is, what would you rather do, live or cut out your sex life? I said, that's a stupid question. I said, because I want both. But again, I have to say, though, that there was a period of time that I waited to be sexually active again, only because of my partner and myself. And I'm not sure whether it was 2 weeks or a month or something like that. But after that, it was, back in heaven again.
When I got hooked up with Dr. Pranic, my wife and I both felt that we were being handled by a real professional. And
Dr. Pranic, I've known him a long time. He's a very fine physician, a very fine gentleman.
He was very highly recommended by a couple other physicians. Treats his patients with like he's your friend, and helps you, relate to what's possibly going to happen.
His style of doctoring is to answer all your questions and actually give you a lot of information even that you don't ask. It's what I call a good bedside manner.
Well, I think that he has a team that you kind of feel confident with. He works with very good urologists.
You're not a patient. I didn't feel I was a patient. I felt like I was more of a friend. We were doing this together. It's not I'm doing it to you. Okay? And that's the feeling I had, and that's the confidence I've had, and I still have in him.
Really a very personal guy, and he's available. That was a nice thing. When he was going through the transition, there's not many physicians that'll give you their personal cell phone number. And he was going through the transition. I was kind of in limbo, and he said, here's my number. Actually, I called him in some meeting in Texas, and he was giving a speech, and the phone rang. I'm in a meeting, but he called me right back.
Easy to talk to. Doesn't look down on people. Explains anything you ask him.
He's the go-to guy in the Capital District, I know. But, we're pretty confident with him.
The advice I would give is, one is to be sure you have confidence in your physician. That's one, because they're going to answer all the questions like Paranik.
I've been very happy with Dr. Pranick, yes.
I have ultimate confidence in him.